Everyone, we're going to give it a couple more minutes. Morning.
Good morning.
Good morning, Senator Erickson. We're just waiting to get a few more folks.
Okay, perfect.
Everyone's in from the waiting room. So far, we only have 3 panelists as I see it.
Yes, everyone's in from the waiting room right now.
Okay, thanks. We're at 4. Hello, Representative Williams.
Hello.
Good morning.
Good morning.
We're sending out a panel reminder now. I guess one question would be to the chairs. How many panelists do you think we need to have on the call before moving forward? 6? Does it need to be a?
How many do we have?
I believe we have 4.
Yeah, I think it would be ideal to at least have a quorum.
Yep. Mhm. Okay. Well, we'll wait a little bit then. Yeah, I was just told this panel really has 8 total. So yeah, we would need 5. So we just need 1 more. Morning, Bill. FYI, we're just waiting till we get a quorum. So far, we have 4 out of 8. We want to get to 5.
Great.
Great. Let's see. All right, McLean, did you just join?
I did. Good morning.
Good morning. Okay, we are at a quorum now, so let's get started. Thank you, everyone, for making this session bright and early. Really appreciate it. This session is the final scheduled session of this process, and so we're going to work through the agenda that's here, and I'll talk about that in a second. But I did want to say up front a couple things. One is that any information that's in this document really either just kind of reflects the votes and views of the panel up until now, and any information in there around sizing of the funding envelopes really is just meant to be like a starting point for the panel to discuss. And the intent is that, every decision, every number that comes out of the session really should be driven by the panel and no one else collectively. And, my personal view is after having worked with this panel throughout this whole process, I'm incredibly grateful given how busy everyone has been and is around there spending the time on this. And also, I have a great deal of faith in this panel that whatever answers it comes up with is going to be a great answer for Kansas. So those are all the points that I was going to make before diving in. I guess I would ask the chairs, do you have anything you would add as we start out?
Yeah, it's Renee, and I would just like to thank everyone for their time. As John said, I know we are all very busy, and to make this a priority and participate, I appreciate it. Robin has been a fantastic partner in this, and John in leading the process. And I agree. I think we'll come out with a great product, and I'm excited that we're at the point we're at today. It seems like it's been a long time coming, so I'm just excited to get in there and really dig into making those recommendations. So I'll let Robin speak.
I would just say the same. I would thank everyone on the panel. I know how much work it's been because I've been right there beside you doing it. So I appreciate your diligence and your commitment to making this work and to making both healthcare and education in Kansas stronger.
Great. Well, with that, I'll dive in. So I'm going to spend a little bit of time talking about the purpose in terms of where we are. And I'm sure everyone is incredibly sick of this slide at this point because we've shown it in both the first session where we were kind of all aligning around the process, as well as every single session since then. But really, this hasn't changed. This is how the process was structured up front, and we've just, the panels continue to move down that funnel in terms of setting priorities. And as the chairs mentioned, we're right at the point now where the choices need to be made around where the priority investment should be based on the channels, the panel's collective judgment. So with that, let's go to the next slide. This is a little bit of a different way of showing all of that. The goals for today align on the panel's priorities for the minimum and target funding scenarios, both overall and against each one of the areas that have been prioritized, as well as identifying, knowing that and talking a little bit about the, within each one of those, the associated ideas and kind of reviewing where the fit ratings had come out from the panelists. That'll help, hopefully, the panel think about sizing the funding envelopes for each one of the areas. Go ahead. So this is kind of a third slide that says a little bit of the same thing, but once again, goal finalize the priorities for minimum and target funding scenarios for programs. Building on the idea submissions, but also the fact that there was a little bit of top-down work that the team tried to do, really just the starting points. It's really just illustrative to almost say, if you made some assumptions, here's what you might get at different funding levels. Really, that isn't meant to define any of these programs. The panel's already really defined the programs. It was really just finding some way of being able to identify what level of value could be created at the different levels of the funding envelope, in addition to looking at the idea submissions. And then at the end, once we walk through that, discuss the key messages for the executive committee. There'll continue to be opportunities once we get for the chairs and really for everyone to continue to review the program templates, which will be updated based on what comes out of today, as well as the materials that would go to the executive committee. Next slide. Once again, just to go through this, the Health and Education panel created principles, and a lot of them were aligned with the SPARK guiding principles. The focus here was one-time use of funds, and the Health and Education panel put that in as one of their principles as well. Understand where you can leverage other funds to maximize use of these funds. The third one, I think, is really the big one, foster long-term systemic impact for Kansans. So the goal, as I've heard it described several times, is if you're standing out 10 years from now, could you look back at the investments you made and say, okay, those are catalytic investments that really made a difference over the long term for Kansas. Consider equitable opportunities and outcomes, ensure flexibility within the investment strategies, and ensure results are measurable to enable tracking and transparency. And we've also obviously brought that transparency into this process as well, with every meeting being, recorded and streamed. The additional from the health and education standpoint, one goal was to investment should build on proven interventions and expert recommendations. And hopefully we've brought some helpful experts in to talk about some of these areas. And it was a broad set of areas that this panel looked at. Should be made in largely allowable programs in places where existing funding is insufficient and limited. Investment should support statewide long-term transformation versus short-term solutions. and investment should avoid establishing programs requiring ongoing funding. Obviously, this is meant to be a one-time use of funds. So anyway, these are the guiding principles for everyone to continue to have in mind as they have throughout this entire process. Okay, next slide. So there are a few things just kind of setting things up. There are lots of sources of input to the discussion that the panel can have today and the decision making it can do. One was the program input survey, continuing to provide input around the program reports. We're going to continue to do that. Idea submissions, rating Excel. So in order for the panel to be able to, within each area, identify the level of fit based on their judgment against the parameters that the panel had created for ideas. The other thing that we've done in this is that, and we'd offer throughout the process, is if there were some ideas that had fallen out of areas that the panel had decided to focus on, if there were some ideas that people felt strongly about, to feel free to, in some of those other areas, to pull them forward. And we've included some of those in this document as well for discussion. And then a lot of input from the live discussions and meetings 4 and 5, and we'll get into some of those results right now. So in terms of just thinking about at the program area level, here's where we came out in terms of 2 exercises, one in a session and one in terms of a homework. That looks at each one of these program areas to try and get a feel for, if you need to make choices, and there's only so much funds and so many things you can do, although obviously there's lots of need given the number of idea submissions that came in. What are the areas that the panel thinks it should focus on in order to make that kind of long-term impact for Kansas? And so what you see from this is that health facilities or program expansion was a relatively pretty high priority based on the panelist input, as was workforce pipeline development. And you'll see, I think it's just based on who was in the samples at times, that there were some, differences somewhat between, what happened in the session and what happened in the homeworks. But generally, those 2 definitely have consistently been pretty high on the list. A couple others would be targeted support of housing and employment. That was a little bit lower in the polling in the last session, but still, in the top 4, and certainly in the homework rose a little bit higher. And then community-based resources and navigation. Although we did want to show the distributions for sure on community-based resource and navigation. There were some mixed feelings around that as well. Some people felt very strongly about it, and some people didn't think it should be as high a priority. Then you get down to the level around the child care capacity accelerator, telehealth option and utilization, home visiting services, early childhood data integration, and then systems enhancement. Certainly in the last 2, not as much. Energy necessarily around those. Doesn't necessarily mean that the panel would decide to not focus on them at all. That's going to be the panel's decision. But this is kind of where things came out. I guess with that, I would just open it up to the panel to talk about this. Is there anything that surprises them? What are their thoughts about this?
John, it's Renee. And I would say that I think part of the issue, as I started looking at the specific submissions, I personally hear a lot about workforce development, but looking at the parameters of one-time funds, some of that, and then looking at the submissions, it didn't necessarily correlate with what I personally thought was a high need area. I don't know if that makes sense, but I don't know that looking at the individual submissions, the parameters that really matched with going into some of the previous exercises, what I thought would be a higher priority.
And
So-
I'm sorry,
Okay.
I didn't mean to interrupt you.
No, go right ahead.
I see what Robin's saying, although I see it just slightly differently in that it didn't change my perspective on the need, but I didn't see the correlation in the number of submissions, or at least the way those submissions were drafted with how we sort of narrowly focus the prioritization area.
Yeah. Yeah, you know, that is one in some of these areas, for instance, health facilities or program expansion. You know, obviously, when you look at the dollar volume of what was in the idea submissions, you know, that's big, right? And it would be big because it involves construction. So there's a lot of pass through there. You know, workforce pipeline development, I think Robin had mentioned it before, you know, a lot of the ideas were kind of very narrowly in the idea submissions. But once again, I mean, if you went back to the funnel, the whole purpose of this process was really meant to be strategic, right? Where it was the panel's judgment, looking at a variety of things, you know, expert views, needs assessments, as well as the idea submissions to understand, you know, what are the areas to focus on. Workforce pipeline development was certainly one where, you know, it probably wasn't covered as well as some of the other ones were in terms of the idea submissions. Maybe that's somewhat of an indication around need, you know, but, you know, that is a factor there. I'm sorry, I probably just walked over you, Robin.
That's okay, John. As I looked at, you know, I went through all the submissions in the beginning, and then I went through them again last week. And we're missing, in my opinion, we're missing, quote, the big idea for workforce pipeline development. And to me, it was almost an indication that the need is so big, no single organization or entity can tackle it, because we really need a big idea. And I've used this example before, like STEM, but I don't know that any individual organization that submitted an idea is large enough to take that on by themselves. I don't know if that made sense, but that's how it seems to me. It's just, it was so overwhelming that organizations just said, well, this would help my organization.
Yeah, understood. Any other thoughts or comments on this? All right, well, keep this you're kind of in the back of your minds as we continue to work through this process as kind of an input to think about relative prioritizations as well as funding envelopes. Go to the next slide. So I had touched on this earlier. And once again, as I said before, in terms of if you look at the two columns to the right, minimum ask and target ask, those are just placeholders at this point. That, some of it based on feedback, some of it based on just trying to kind of think about wrapping the group's heads around what it might be able to get at different levels here. But at the goal of today, one of the goals is to actually, for the panel collectively, to decide what those minimum asks and target asks would be. What we did here, though, also was overlay the output from the idea submission exercise to give a feel for, where the high fit submissions, if that's an indicator of need, kind of where they play out, particularly against those potential funding envelopes. And so what you'll see is that, as I mentioned before, health facilities or program expansion, that's pretty straightforward stuff. And to the extent that it's kind of construction related, it can be pretty big. So that dwarfs, potentially that minimum and target ask. Workforce pipeline development, that was an area, as Robin just mentioned, it may not be that the idea submissions really captured the big idea. There were a number of submissions, but they tended to be much smaller. The targeted supportive housing and employment kind of fell within the range. Community-based resources navigation was above. Child capacity accelerator was above. Telehealth was slightly above, and then home visiting services, because that was kind of a new idea to begin with. There wasn't really anything there that we saw. And early childhood data integration was kind of in the range. And then one other thing to mention, as I mentioned earlier before, there were three ideas that people had, we saw in the voting, had put forward that fell outside of some of the prioritized program areas. And as we've said several times, let us know if there are any there that you think are really important ideas, and we'll pull that forward for discussion. And so that was about $4 million worth of ideas. There were three. One of them had been rated as high fit, but that may just have been in terms of how it was input. So as you'll see, if you just look at kind of those high fit ideas and the funding from them as defined by the group, versus potentially an ask in the range of 135 to 315, not an ask, a funding envelope. So you would understand, this would allow the Spark Executive Committee, because at the end of the day, they're going to be the group that really decides, based on looking across all the recommendations. Generally, that was kind of the range where the group and where the chairs had come out and say, hey, if we wanted to offer a reasonable range, given, and once again, this was targeted at $721 million overall funding envelope. And that's, changed a little bit, could continue to change, but, stay with that because we have a fairly low minimum ask. But anyway, that's kind of where we came out, trying to work backwards from that against, these minimum and target asks by program area. So the rest of the document is really going to kind of try and go through each one of these program areas. Well, we're going to actually have a couple more slides to actually help you maybe think about some ways of kind of allocating funds. But the bulk of the time today is really going to be going through program by program with a little bit of kind of top-down illustrative analysis, and then being able to understand the idea submissions for fit, and then have the panel itself decide on what they want to have as the minimum and target asks. And then we'll be able to show how that's adding up as the panel makes decisions program area by program area. Go to the next slide. One thing we'd want to point out, and once again, this was just kind of a dummy slide that it doesn't link back to the other one, but just generically, the panel could decide that, I want to place bets, in all the program areas, right? Or it could decide, I really just want to focus on the top 2 or 3 or 4 or whatever, right? So keep in mind, the panel can make that decision as well if the panel wants to. It's totally up to the panel with regards to that. Just wanted to kind of give you a heads up that, certainly that is within the range of options that the panel could select. Go to the next slide. And then here's a more specific kind of illustration of, given the math before, what that could potentially look like here, right? You could make bigger bets on 5 programs, the top 5 as they seem, or you could make some bets across all of them, right? And just distribute it that way. There's certainly implications for making that call, but once again, it's up to the panel to decide what they feel is the right answer there. I guess before we jump into each one of the areas, any thoughts around that in terms of how people feel about, and we'll revisit it at the end too, by the way, but any thoughts from people around how they think about those 2 types of strategies?
Could you back up to the slide before this one again?
Sure. By the way, that was just a generic slide.
Yeah, I know, but it's the theory behind it.
Yeah.
Okay, thank you.
Got it. And some of the things to think about too are, that, given the size of the ask, I mean, there is a benefit to focusing on more things and having a portfolio, right? And from a business standpoint. There's also a benefit to really focusing in on the most important things as much as you can. So there's trade-offs here, and the panel is going to need to collectively decide where it wants to go there. Okay, the one thing I will mention is that, go back to that slide, is one implication is if it did play out like this, you'll see that the two of the things that fell out were education oriented. So if you think about the portfolio, the workforce pipeline and the community-based resources has a little bit of education to it, but there are kind of portfolio balance issues there as well. So go to the next slide. All right, now we're going to jump into this. Once again, there are a lot of materials that are going to go to the executive committee in terms of the program reports that we're going to continue to refine coming out of this, the idea submission ratings. We want to be able to provide the Spark Executive Committee with kind of a breadcrumb trail of how we ended up through kind of the panel's voting, kind of where, how it got to the recommendation that it did. Today, the big thing that we're focusing on is the portfolio recommendation. That would be the core of what the chairs would present. Around here are the areas that we wanted to focus on, and here is our view of the fit of the idea submissions within those areas. Okay. All right, so we're going into the first one. Consider this kind of a placeholder at this point, because anything around the target ask or minimum viable ask, that's just placeholder. We're going to change that coming out of this. People have had a chance to kind of talk through this in components as we've gone, and we'll continue to have a chance. So we're going to treat these slides for this discussion really more as placeholders. So anyway, we're heading into kind of the health facilities or program expansion discussion. So, and I'm going to go through this and then kind of back up again just to give people a feel of what the general train of thought is. So the first slide in every one of these sections is, all right, here's some just rough top, if you made some assumptions about what you could focus on here, what you might be able to get for a minimum ask and a target ask. This isn't meant to add an extra level of definition around these programs at all. This was literally just trying to do a little bit of, provide a little bit of a top-down guidepost for folks to say, okay, how do I feel about a minimum ask versus a target ask? Go to the next slide. But then what you'll see is in the subsequent slide, or in this case, 3 slides, because there are a lot of submissions in this area, we have the program parameters that on the left that the panel had decided on in order to kind of view the fit, consider the fit of each one of the ideas. And so what you'll see on the right is each one of the ideas and the dollars associated with it that got at least one high rating in terms of high fit. And then you'll also see in the upper right-hand corner, you'll be able to see that, okay, and by the way, I believe the N here equals 4, that there was one submission that got high ratings, 4 high ratings, high ratings from 4 people, and that accounted for $3 million. There were 3 that got submissions, ratings of high by 3, and that's 7.4, and so on all the way down the list, to the point where you're able to say, okay, there were 22 submissions that got at least one person voting saying it was high fit, and that's a total of $287.1 million. You'll see that actually a big bulk of that was kind of, ones that just had actually one of the people rating the fit as high, and that brought in kind of the last tranche of $245 million. So with that, let's back up to the top-down exercise. This is kind of the bottom-up navigator. In terms of the top-down piece, rather than my trying to go through all of this, because I'm really not an expert on this stuff, you all are experts far more than I am, at least collect. Here was some kind of what if analysis around the program scope, potential funding considerations, talking with experts, and also just looking at the idea submissions that came in and said, if you made some assumptions, if you had a $25 million minimum ask here, once again, it's not going to play out like this. That might be 3 health facility infrastructure projects at, 12.5 million, so 5 million each, which was the median for the submissions. Could be 4 innovative care model and treatment projects, and then here's how it could ramp up, if it was 75 million. So just to give people a ballpark, once again, this isn't defining program, but just so they know kind of what this might potentially look like at the various levels. So go to the next slides. So once again here, you can see, and I don't know whether everyone's had a chance to kind of absorb it yet. I'll kind of let people look at each one of these slides for a minute or so, go through them, and then we can come back to the discussion. Because once again, this isn't probably going to be an easy exercise necessarily for the panel in terms of thinking through the minimums and maximums. But this is kind of the data points available to think about that. And the intent, by the way, would be for these fit idea submissions to go up to the Spark Executive Committee so they can understand which ones kind of fit the program areas based on the parameters that the panel created and which ones had the most votes. Go to the next slide. Next slide. And so once again, at the summary level, go back to that slide. No, go back to that slide. That ending slide on the idea submissions. There were 22 submissions that were rated as high. There were 19 submissions in this that fell into this area that weren't rated as high by anyone. So some just didn't make this list based on people's ratings for fit. So go to the next slide. You really want me to do this slide. I was going to just try and see if we could do the voting slide. Keep going, next slide. So here's the tracker. And we can certainly go back to any other slides if people think it's helpful. Although I know everyone's been looking at all this stuff for a long time. It probably feels like years at this point. But I guess my question would be, and once again, this tracker will get updated as we go. But, as placeholders in this area, had been put in a minimum ask of 25 and a target ask of 75. If you're working against, a range of what, was being looked at before for an aggregate. But the question would be, I guess I'd open it up for discussion because it really should be discussion. How do people think about this range? And, in order for the panel collectively to kind of come up with what they would feel comfortable putting forward.
So I guess my struggle with the range is, I guess viewing it in isolation, and I wonder if there's opportunity to like reapportion between them, knowing that, or at least how it looked to me, we had one of the areas that came in much lower than the target, and so if there might be room to reapportion some of that to this,
Sure.
or what your thinking is around that.
There could be, sure. Whatever the panel wants to do.
So the
Robin,
thing, I'll
go
throw out
ahead.
my 2 cents here. The thing about this one where there's 287 million, which obviously is the largest one number associated with any of these 7 or 8 categories. There are several proposals or asks that are within the 50, 60, 70, 80 million dollar that all fit within on the little box in the upper right of the slide or screen on several of the previous slides.
Yep.
Several of those fit within the row that had one person rated as high, which was
Yep.
245 of the 287 million.
Yep.
And the reason I didn't personally, I'm not speaking for everybody else, the reason I didn't personally
Yeah,
rate
and I
some of
don't know.
those, the reason I didn't rate some of those as high was if you ask for an $80 million and some of those are $60 million, and obviously you're not going to get anywhere near that. So if you get $5, $6, $7 million, some of those just weren't going to be able to do the project. So if you just take the number of high ratings at 4, 3, and 2, that's $42 million. I mean, even within that 42 million, 20 of that 42 came from a request or proposal from KDADS that I think is somewhat questionable on their NFMH proposal. And they have a grant that they're working on that they haven't even necessarily worked out yet with partners. I think that was just kind of a throw out the money because it's available here. So to me, the all that to say, the range that's probably there is right, and it would allow for even some of the proposals that are in the 1 rating to get funded at lower levels within that 25 to 75 category.
I agree with Sean, and he said it way better than I was going to say it.
Agree. Sean, great job in explaining that. I was sitting here trying to think how to articulate that. So yeah, I think Sean hit the nail on the head.
Well, that sounds like it's the proposal on the table. Anyone have any, different thoughts around that they would want to bring forward? All right, well, let's move on. Let's move on to the next one then. Okay, once again, treat this as a placeholder, but this is a pretty important one because once again, per Robin's point, this really probably, I think what you're saying requires kind of a whole Kansas holistic strategy, right? Looking at the intervention areas that could drive the pipeline. Go ahead. So I'll give you all a chance to absorb this a bit. That once again, there could be an awful lot here. The focus in just doing this kind of what if sizing was kind of focusing in on things like student education grants and workforce development program grants and what they might be able to be in terms of size and what you might be able to get if you made those assumptions at a minimum ask level and a target ask level. And so I'll let you all look at that for a minute. Once again, this isn't the proposal. This is just really trying to maybe help provide a guidepost for folks to think about it a little bit from a top-down standpoint. Go to the next slide where we get into the idea submissions. So if you look here, again, once again, rated against the program parameters on the side that the panel had created. You can see how the idea submissions played out in this area. There was no submission that was a high for all four folks who looked at it. And really a lot of the idea submissions, and they tended generally to be fairly small, except for the nurses program relocation and staffing. A lot of the bigger money was in the ones that hadn't gotten raised high by as many people. So thing to think about here. Oh, by the way, this is based on input from 6 panelists. I kept saying N equals 4, N equals 6. Sorry about that. So with that, let's go to the next slide. So I'd open it up for discussion once again. This one's a little trickier though, because as Robin mentioned before, there's a big idea here that may not have totally been captured yet. So here it's generally a little more generally saying kind of, how much would you allocate to this area? So with that, I'll stop talking and let people discuss.
While I think we are in desperate need of a big idea, some of these smaller, I've said onesie twosies through this whole series of meetings, it might be where we have to start to at least get some jump start on getting people propelled into healthcare and education career paths for this next coming school year, or maybe even the school year after that, while we continue to work on figuring out what the big idea is and how do we implement it.
Mm-hmm. I guess with that, Robin, obviously this initial ask would go beyond what the requests were, and it'd be assuming that you would find some other places to target, right, as parts of the big idea beyond just the ideas here. Are you thinking that you would, that this seems right generally because it's going to be more than just these ideas, or?
I think I would not fund more than what was asked for right now, because I don't think we have the option to say we want to set aside 20 million of these funds and not spend them right now while we figure out what the big idea is. My guess is other panels and other interests will grab that money. So I would say let's spend it on things that have been requested, but we can't lose sight that we've got to work on this. We've got to work on pipeline development and then figure out how to fund it at some point down the road.
So given that, would you say that this is more like 10 to 15 or something, keeping in mind that some other similar ideas might come in? Or
that's what I would suggest, lowering it down.
Yeah. Because, the intent on some of these would be that, if other people didn't have, once they saw the idea and realized that it was the focus, might actually raise their hands, right? So you might be able to get, in the procurement process, a little more involvement. But I do hear you though on let's not try and, or your thoughts on let's not necessarily try and put big funds against it until we have a lot more clarity on the idea. Sean, you were going to say something?
I agree with what's been said. I don't know whether this is an appropriate ask or who the ask would even come from, but one thought would be, so as Robin and Klain and others already said, most of the ask here are more from individual providers or colleges, universities that are very region, location, county specific. I think most of the proposals that were more system from a system perspective or dealing with a particular sector were on the premium pay side, which just I think proved to be too much and not what this panel is trying to address. So I don't know what it's appropriate to go back to some of those folks, associations and trade associations, and just sectors, industries, ask them to get together and say, you have 2 weeks, you have 3 weeks, come to the executive committee and come to us with a proposal with X amount. Is it scholarships? Is it pipeline development? Is it sign-on bonuses? It's something other than what you all proposed, because that's just the level of ask wasn't doable. So come back with something more of the front door approach that the panel recommended.
Senator Erickson?
Yeah, I agree with that. And I think part of the issue is we need a systemic solution. And when you're looking at one-time funds and it's like a pay raise, or that really doesn't get to the heart of it. And I know legislatively, we're looking at like the Promise Scholarship, which is to give scholarships to students to go into these high need, critical need areas, and healthcare is one of them. But I think if, like to Robin's point, if we would have had something like that, but pay raises at their one time doesn't seem to really get at the heart of providing that pipeline. And I think that's why I struggled with this particular area.
Yeah, I think the panel, from what I heard pretty clearly, it wasn't around the pay raises. It was around trying to kind of work deeper in the pipeline to bring people into it. So, the panel certainly, can define it what it really wants it to be in on, and I believe that it has, as Sean had mentioned. I guess I would just ask someone, based on the discussions we've had now, because I don't want to do it, just what would you propose as the minimum and target asks, and then everyone else can react to it.
Can you back up one slide so we can see those again? I would propose kind of a $10 to $15 million window.
Okay.
Because I agree with what Senator Erickson said, that pay raises and one-time bonuses, they're good for the moment, but they don't last. It's building the pipeline to get kids thinking about coming in to be a nurse or be a social worker or be a addictions counselor or be a teacher or be whatever.
Yep. So go to the next slide. So if the proposal is 10 to 15, looks like it's already changed. Would like to get some discussion around that. Does anyone second that? Does anyone think that it shouldn't be that?
I second that. I think that's exactly what I was thinking, 10 to 15.
Well, I just got a question. If we are, if there's an opportunity for us to go back and seek some additional proposals, do we readjust the target ask now, or should we wait? Are we comfortable that any proposals we might get would keep us in the 10 to 15 range?
Yeah, I mean, once again, if you think one of the big ideas is scholarships, you certainly could, in the procurement process, ask for more, right? So you could up this range if you wanted to, but really it's up to you guys what you want to do. So with that, everyone still want the 10 to 15, or let's put it this way: you have 3 or 4 seconds. If you think it's wrong, let me know.
Yes, it seems like everybody still strong with the 10 to 15, so we can move on.
Got it. Great. Let's go to the next one. So this is targeted supportive housing and employment. So once again, this is kind of the placeholder. Go to the next one. So once again, with some assumptions around employment and around housing, Here's what 25 million could look like or 75 million look like. Once again, this had been much more focused around the housing, and then based on the last session, it had been suggested to add some employment pieces here. So as a result, this analysis just did a what if around both of them. There may be some issues around, on the employment piece. I'm not sure around to what extent that would be an ongoing use of funds. So go to the next slide. And then here's what it looks like from an idea submission fit standpoint in terms of the high fit ideas, based on the parameters that the panel had developed. So here it's, 38.1 million associated with it out of 13 high ranks. All right, next slide. So I would just open it up for discussion based on what people saw here. Once again, taking both factors into account. Once again, the other thing I just kind of want to stress for everyone to keep in mind is that the idea submissions were meant to be they are an indicator of need, but they are just meant to be kind of one source of input, right? So people shouldn't necessarily be just purely, limited to what's in the idea submissions, but it is one data point to look at. So that being said, open it up for discussion. How do people think about this minimum ask and target ask?
Hey, John, it's Renee.
Yes.
I noticed the 25 million was a KDADS. Can you refresh my memory on what that specific ask was? I apologize. I don't remember what that was.
Here, go back up.
Yeah, I actually am looking at that one now on the spreadsheet, and it's around Housing First Pathways model of supportive housing and Oxford House recovery housing, as well as additional promising practice related to recovery housing. So I flagged that one. I mean, it sounds great. It's 25 million of the 38 of ask. Again, as John said, this is just one source or data point for fitting within the potential range here of an ask. But I don't know enough about that particular proposal. It probably is great to know whether that's something that should definitely fit within here. It probably does, but it's 25 of the 38 million.
Yeah, the other thing to keep in mind as you look at this area is that if you then said, if the panel said we really want to focus in on this area and then kind of went out for asks around it, you could get other things coming in too, right? So as you think about the window, as I mentioned, don't necessarily be, this is an important data point, but don't necessarily think this might be an indicator of all the need that's out there too. That being said, Sean is right. That is a big part of this overall number.
Sean, could you say more, if you know more about the KDADS ask? Is it just kind of a generic, let's try to get some of this money and figure out then what to do with it? Or is it a solid plan that's they already have developed?
Yeah, to be honest, I'm not sure, Robin. It mentions particular models of Housing First Pathways model and an Oxford House recovery housing, because it's been so long since I have been at KDADS. Those are programs that have come along since I'd left several years ago. So I don't know the efficacy of those and what they are and where those models lie and if we've done them in Kansas before. So I am not the right person to ask, but definitely should be asked as part of this process.
Does
Okay,
anyone
great.
else on the call know? All right, go to the next slide. So what are people's thoughts around a funding envelope for this area?
I think this is an important area, and I can speak better for health and behavioral health than I can for how this impacts education, although I can imagine that kids having a place to live and parents being employed makes a significant difference in their education. But this is one I would be comfortable funding somewhere in the 30 to 50 range. And then potentially asking for more proposals or ideas.
Yep. Anyone else have any thoughts around that, if it was going to be 30 to 50?
I could agree with that. I could go 25 to 50, 30 to 50. I think that's a reasonable range for this funding
Mhm.
envelope.
Yeah, I agree with Renee, 25 or 30. I was in my head going back and forth, so.
I think
Anyone?
they agreed that should be 27.5 to 50.
27.5 to 50?
He's compromising.
Yeah, there you go.
Sean's a true statesman. Good job.
Anyone have any other comments on this that they would, or are they good with where it stands now? All right, well, with that, let's move on to the next one. Community-based resources and navigation. So once again, this is the placeholder. This will get updated, as we go through. Go to the next slide. I'll let people look at that. And once again, I think, I should mention here, this was an area that at least, one of the people providing input didn't feel great about. So I just kind of wanted to get that out there just to make sure that people knew there was a little bit of a difference in opinion on this. But here are some assumptions that were made around what this could look like in terms of potentially service hubs, navigation services, if you made some assumptions around funding, and then what that might be able to get you in terms of minimum asks, at the minimum ask and at the target ask. Go to the next slide. So once again, this was an area that, had a decent number of submissions, and some of them were kind of bigger ticket submissions. And some of the bigger ticket ones, at least that $30 million one, at least had a couple people rating it as high against the parameters that the panel had put together. Go to the next slide. So once again, this was an area where, the dollars associated with 71 million. If you kind of looked at where the relative prioritization may have stood in terms of some of the input that had been gotten earlier from the panel, thinking about funding envelopes of the programs across each other, like this default ask at the start was set lower than that. But once again, I would open it up to discussion, because at the end of the day, those numbers need to reflect the panel's judgment.
Did you go back one slide? this was one that I really struggled with. And it's similar in my mind to the pipeline development workforce. There seemed to be counties and communities that were kind of plugged into asking for money. And if we think about systemic change across Kansas, and then you look at some of these little tiny communities that have, say, a $20 million ask,
Mhm.
that's where I struggle with how to disperse the funds fairly, I guess.
Mhm. Agreed. Once again, with these, the idea submissions would continue through the process, as the panel wants them to, but there would need to be some procurement, in which case, there wasn't enough information in these idea submissions to do a final procurement anyway, where you would probably be able to look at some of those things, or someone would. But it's a reasonable concern. Go back to the next slide. So any proposals for what the funding envelope should be here?
I'll throw out, so there's 70 million of ask, again, to reiterate, that's one data point, as John keeps
Mhm.
saying appropriately. 50 of the 70 million are from two proposals.
Mhm.
And not to say that neither of those or what are both of those are not worthwhile submissions and wouldn't be
Mhm.
great. I would throw out, I guess, 15 to 25 as a range based on the ask and the range.
That's
Why don't
about
we-
what I was thinking too, Sean. I was maybe thinking even a little bit lower than that, but I could certainly do 15 to 20 or 25, whatever you said.
Here, let's put up the 15 to 25 and see if anyone would change it. Now that people see it on the slide, does anyone want to change it?
No,
guess
I'm in agreement, John.
Okay. Okay. So I'll give people 4 or 5 seconds if you disagree. Otherwise, we're going to assume agreement. Okay, great. Let's move on to Child Care Capacity Accelerator. Go to the next slide. So once again, I'll let people look at this. Here are some assumptions that were made for a top-down exercise around what you might be able to get with $25 million or $50 million, if you try doing certain things. Once again, I don't want to bias it, but this was one area where there was kind of like a double hit, right? In terms of, the need around childcare generally, but also the fact that it could have an impact on the economy as well, giving people the flexibility to be able to work as opposed to staying at home to caring for kids. So just something to keep in mind here.
So are you saying this was like in the economic development panel as well?
These ideas aren't in there, but it's been mentioned in that panel as, we need, and certainly in all of the listening sessions that happened last year around, hey, we have an issue around, childcare, right? No number attached to it or anything like that.
Okay.
And I'm not aware of what's happening in this area, you know, across all the other parts of Kansas as well. And keep in mind, based on the direction of the panel earlier, you know, really kind of encouraged to think about this from the lens of partnerships. And so that's part of what this the straw man top-down analysis reflects. Go to the next slide. So once again, the program parameters that the panel created, and then, you know, a couple slides here of submissions. So take a couple minutes, look through this one, and then we'll go through the second slide, and then we'll have the discussion again. So a good number of the submissions here, you know, were actually rated as high by 4, 3, 2 people. Go to the next slide. So if you took out the votes that got 1, right, you're at 60. If you're just looking at ones that got high ratings of 4, 3, or 2. Go to the next slide. So who would like to open up the discussion here?
If we take out 2 or 3 requests that were really much more significant requests, like 10 or 20 million dollars, than what everybody else was asking for, I think that 25 to 50 or 30 to 50 range probably seems reasonable, because I do see that increasing capacity for childcare is going to help with with students going to school. It's going to help with people finding jobs. It's going to help with economic recovery for many small communities. It's going to help with nurses or physical therapists being able to go to work and teachers being able to go to work. So it's got a broad base of impact.
Mm-hmm. Anyone else have any thoughts on that?
Sorry, go ahead, McLean.
No, I was just gonna echo the importance of this area and the interrelatedness of it all, and the opportunity to be impactful in multiple areas with just childcare alone, or what seemingly is just childcare really isn't just childcare.
Mm-hmm. Yeah. Sean?
I thought there were a lot of wonderful proposals in this category, probably more so than some of the others. And I would almost, in my head, as I was going through these, and certainly I'm not an expert, having 4 kids is not making me a child care capacity accelerator expert
Well,
by any means, but I wonder if whether it's possible to kind of pattern during the procurement process in a couple of areas. One is the infrastructure needed through some of these proposals and submissions to expand their facility, to allow them to provide higher capacity in this area. The second, there were a couple of proposals that were very intriguing, kind of an incubator type idea,
Yep.
submissions that would assist with recruiting, mentoring, coaching, training new individuals interested in starting childcare business, expanding services. I'm actually reading from one of them now. And if that could be that could be kind of a second area of focus as that procurement goes out.
Mm-hmm.
But that part was intriguing, of kind of
Yep.
system capacity type of building.
Mhm. Would that change? I mean, we can certainly, and I believe that is kind of incorporated in some of the thinking. We can make sure that that would be in the, you get a chance to put it in the program template in terms of guidance of what to focus on. That being said, would that change your thought around a minimum ask, Sean, from 25 to 50?
No, I think that's probably the right range.
Anyone else have any thoughts on that? Okay. Great. Let's move on to the next one, telehealth. So once again, there's a place where we will change this for whatever comes out of this. And, this was an area that, maybe it's been a little bit more kind of challenging to kind of profile a what if around from a top down standpoint. It was more kind of a mix of things like pilot programs. So I'll let you take a look at this, but this is, could be theoretically, if you took that approach, what you would end up getting for 5 million versus 10 million. I think we've mentioned before, there are a lot of other enablers in this area as well. You'll see under the funding considerations on the homework survey itself, some respondents actually had some other suggestions that you may want to take a look at, really kind of around scoping. Go to the next slide. And here you can see kind of what came in this area from an idea submission standpoint. This may not have been an area that was kind of well defined as much from an idea submission standpoint. At the same time, if you looked at kind of the relative energy it got from the panel, it probably wasn't going to be looked at as a big funding envelope to begin with.
It seems to me the most important part of making telehealth work is access to good internet.
Mm-hmm.
And isn't there a committee working on that?
Yes.
My opinion is my vote would be not to fund this area at all.
Go to the next slide. So anyone have a different view?
So is the thought that we wouldn't fund in this area at all, that funding would come from one of the other committees, or recommendation would come from the other committee?
Well,
or
the way that,
a discomfort in just, I guess, the unknown
yeah, I think
of whether or not there would also be funding for the digital equity that would be needed for telehealth, or the digital access that would be needed for telehealth.
Yeah, in the connectivity panel, it's going to make a recommendation about building out infrastructure, as well as, kind of accessibility and affordability around that. So there will be the two pieces there within that, not necessarily directly targeted at telehealth, but certainly it's an enabler for this area. So that is being considered elsewhere.
I lost volume for a second. Did you hear my question?
I did.
Okay, cool.
But to your point, Robin, yeah, the other panel is primarily focusing on making sure that the infrastructure is in place and that people have access, and asking for some significant investments against that. So are what you kind of suggested here, Robin, and this actually gets back to the earlier kind of dynamic we talked about. Potentially you could decide to go 0-0 here if you wanted to.
That's what I would, because it seems to me the biggest impediment to people being able to access telehealth is whether or not they have access to internet services.
Mhm.
And that other committee is working on infrastructure for broadband access and affordability.
Yep,
And really what you need is a smartphone
yep.
and access to internet. And you can obtain telehealth services wherever you are.
Yeah, and just to be clear, those are the two things that their other panel is going to come forward with a recommendation on.
So my vote would be to do our minimum, and our target is 0 and 0.
McLean, you're unmuted. So
Yeah, I
think you
mean,
wanna say something.
I'll go on record as not supportive of zeroing it out. I totally agree that the two are highly interrelated. But I think it's, you know, access to telehealth is a bit more nuanced than just you know, the broadband access or the smartphone. And from my vantage point, with telehealth being sort of the wave of the future, the only opportunity for, you know, accessing specialty care and what have you in rural areas and even some urban areas, and not having really, you know, parsed through the proposals that we got themselves to know if they are, you know, worthy. And I guess it's more of a question of that for me than it is just wanting to defer. And I don't want to characterize what Robin has said, but wanting to defer this sort of area holistically to the other committee.
Well, let's go back up to the idea submissions and see what's in there, just to get a flavor. I mean, the connectivity panel isn't focusing on things like this, right? It's focusing on getting the infrastructure in place, and then making sure that it's accessible and affordable for folks.
Yeah.
Right. So
These are more availability than access. These are more, you know, the providers themselves, their ability to offer these things, and literacy and just the offering of it versus on the user end, which I don't know if that's what the other committee will be focused on, the user sort of end, and digital access, but this seems to be more provider focused.
Yeah, the other panel is not focusing on the provider side at all in this area. So I guess go to the next line. You know, and I guess I would ask you, what would you think is the most important to fund? You know, just generally, not an idea submission, but what are the types of things that, you know, if there were going to be funds against this, that you would apply them towards McLean?
Yeah, and I guess, like, you know, programmatically, the things that I would prioritize would be enabling a rural hospital or clinic, or even, you know, a scantily resourced hospital or clinic or other sort of service provider elsewhere, to offer these services to the patients that would benefit from, you know, having that access to specialty care, or not having to leave work because they don't have, you know, the ability to do so, or they have childcare limitations or what have you.
So that would be more almost kind of like that pilot program concept that was in the top-down kind of what if exercise around helping some people try and think about how to offer it.
Yeah, and it to me just seems like the flip side of the coin of what the other committee is focused on, and it's again just my assumption. But in my opinion, both have to be addressed. And I know it's just kind of me and Robin at this point, which is like a 50-50 kind of deal. So curious what other folks' opinions are on this.
Yeah, it's Renee. I agree that we need to keep something in there. I do see a difference between access and having that platform of telehealth. And so I agree we need to leave something in there. I'm flexible as to the amount, but I would hate to see it zeroed out.
So would you go 5 to 10, 0 to 5?
I'm gonna
I-
advocate 5 to 10, but
Yeah, I'm flexible on the amount. I think we need to have a minimum and a maximum. I don't want to have a zero, in my opinion.
All right. Robin or anyone else, how do you feel about that?
I'm certainly agreeable to go with whatever the majority thinks.
Sean?
Yeah, there are a couple of proposals here that I rated pretty high that I thought were system capacity building ones
Mhm.
that kind of get beyond the access
Yep.
question to broadband that help develop and expand the system. So I would probably go 5
Okay,
to 7, 5 to 10, something there.
okay. Well, I'll give people 4 or 5 seconds, this is what's there now. Any objections over the next 4 or 5 seconds, or we'll move on? Okay, move on to home visiting services. Go to the next slide. Once again, this was one that kind of got shaped a little bit more, kind of midway through the process. Really didn't have any specific idea submissions against it, I don't think. But, here was kind of a top-down analysis of what this could potentially look like. If you look at the funding considerations, the homework survey, input 3 panels indicated kind of limited interest in this area and didn't indicate any high priority submissions. And the team itself, kind of over the course of this as well, sent out some updates around what this could look like, because there was generally a lack of familiarity by some of the panelists. So hopefully that helped a little bit in terms of thinking about this. Go to the next slide. Oh, okay, there were some, yeah, there were no high fit ratings against kind of these 2 areas that had come in. Okay, go to the next. So on this, once again, anyone have a proposal, starting proposal on the minimum and target ask?
Admittedly, not knowing a lot about this area, but with 0 high fit ratings and limited proposals, I would throw out 0 to 0.
Okay, let's put 0 to 0 there for now and see if anyone wants to move off of 0 to 0.
I agree on this one, John. I not knowing enough, but seeing the ratings and I think 0, 0.
Mhm.
I agree.
Anyone disagree?
I don't disagree. I mean, I only disagree because of the proposals that we got. I mean, I'm sorry, I only agree because of the proposals that we got
Yeah,
and
mhm.
and that they weren't appealing to me. I guess my struggle or my hesitation is from, just our perspective at Health Forward, just knowing how important home visiting is just broadly, but in terms of, COVID relief recovery, isn't one that I would prioritize over any of those that we have ranked more highly. So I guess that's where my comfort lies in
Okay.
the decision of the group to
Good.
zero this one out.
And once again, like the workforce pipeline piece, I mean, if you think it's a big idea that you should focus on, you don't need to be limited to the idea submissions, but it sounds like people might be coming out at this anyway. All right, well, unless I hear differently, let's go to the next one. So early childhood data integrations and systems enhancements. Go to the next slide. So, around a kind of $5 to $8 million potential window, here are just some kind of rough assumptions around, what you might get at either end of that spectrum. One thing to note around the funding considerations is that on the homework survey, 2 respondents suggested not funding this program, and 1 suggested a $3 to $5 million envelope. But just to be kind of clear, of people who kind of expressed a view around it, kind of what their input was. Go to the next slide. And here's how the idea submission ratings, fit ratings came out. So 6 submissions were rated high by at least 1 person. 1 was not rated high by anyone. So go to the next slide. I just open it up for what people's thoughts are on this.
Throw out 1 to 3 million.
What did you say, Robin? You're
I said I'd propose 1 million to 3 million on this one.
Okay. Why don't you put down the 1 to 3 and let's see if anyone moves off of that. Anyone else have any kind of different thoughts? People agree with that?
Yeah, I would go with 1 to 3 as well.
Okay. All right. Well, unless anyone has a difference of opinion there, I'll give you 5 seconds to voice it. Otherwise, we'll stand there. Okay, move on to the next one. So this was where we'd asked folks a couple times that if there are some, submissions in areas that had been deprioritized, to kind of let us know and or kind of target them as high fit submissions. And here are the 3 that had come forward in that. So I guess, I would just let people kind of take a look at these and then kind of let's open up for discussion. And particularly if, people feel really strongly about these, I'd certainly kind of encourage you to, put forward your thoughts.
John, I will explain a little bit on the Math Nation. That is part of the conference committee recommendation from the K-12 budget and Senate Education Committees.
Mhm.
And so that's why that one is there. We wanted to use Spark money to get the program implemented. And in the following years, the school districts would pick up the cost from that. So that this was to implement the program statewide. So I just want to give a little context to the Math Nation request.
Mhm. Anyone else have any thoughts? Because what we could do is either put it in or just kind of, recreate a program category around it. If people think this is a good idea now looking at this specific submission.
Renee, could you say more about what the hardware devices and internet piece speaks to?
Yeah, that should already all be in place. It shouldn't require any additional infrastructure on the part of districts. It's a web-based program, and it would be for districts whose students, if they have 50% or more in the bottom two math categories on the state assessment, this is a supplemental to help those kids catch up, because we've seen a big drop, particularly in math scores due to COVID. And so this is a way to try to get those kids back up to where they should be. So I don't think it should take any more infrastructure or devices. It's just to get the licenses and the programming started in those districts.
Okay, thank you. I see now. What that meant was it will work across all hardware devices with the internet. Okay.
Yes, it should. Yeah,
Okay. I just didn't read that correctly.
yes.
Anyone have anything on the other ones? Do I, at least on the first one, are people generally in alignment that seems like something that would be a kind of good thing to try and find a place for in the recommendation going forward?
I would be supportive of including it, because if we have kids that can't pass math and half of our kids are failing in math, we're not going to get them into any kind of healthcare or education career.
Mhm.
And I'll just chime in and say that it's actually our at-risk kids in the state of Kansas, around 200,000 students, are 94% are not proficient in math.
Mhm.
So those are the individuals that are going to be require more services in the future if we can't intervene earlier. So yes, I support.
So if we kind of create a program area around this that would generally be kind of education, what would the funding envelope be for?
Funding on the local, is that what you're asking?
Yeah, if it was around educate, would you just say it's, 5? Because there may be similar ideas to this too, right? So the question is, how would you want to approach it? It sounds like everyone agrees on the idea. I just want to make sure that I'm capturing that, the thought of might there be other ideas as well in this particular area. So you might want to think about this beyond just 4.
So the only thing I would say about the funding amount is that this is a unique one because it's based on the state standards and the K through 12, all the applications that related to K through 12 well, I'm just going to speak from one person, did not receive the priority because they already received $1.3 billion for learning
Mm.
loss.
Mhm.
It was more of
Yeah.
a statewide approach. So I don't know that, from one perspective, I don't know that you would need additional money beyond
Okay,
this.
okay. All right, we'll go to the next slide. So for the purpose of this, let's just put in four, and we'll figure out the right way to portray it unless people object to that.
I agree with that.
Okay, well, my suggestion is people take like a 5-minute break now because I gotta commend you, incredibly productive. And then when we come back, we'll take a look at this. I mean, this certainly is below, the minimum and target that had been outlined before, which isn't necessarily a bad thing. So let's come back maybe around 9:45 and we'll revisit this now that we see it all here. And then hopefully get agreement on it and then move to next steps. So till 9:45. Thanks. We'll give it one more minute. All right, let's go to the next slide if people are ready to start up again. Next slide. So once again, here's where we all came out. You collectively. So I guess the question would be, my guess is this probably isn't where what anyone, if left to their own devices, exactly what they would have allocated for these. But I think we had a really good discussion and very collaborative, and kind of here's the judgment of the group. I guess, looking at it now, in aggregate, anyone have any thoughts, concerns? How do you feel about this?
John, I thought it was an excellent process, and it was good to actually get down to some details and decision making. And I thought that the input was excellent from the panel members. And I think overall it's been a really productive day.
Good.
I agree. If we're going to get to that bottom line remaining funding for allocation, then I think I would go back through from the top and see if there are minimums and targets that we want to increase.
Well, you don't have to force it if you don't want to, right? I mean, it's at this point, you could say, now that I look back and I think where we came out, we may have taken the approach more of focusing less on the things at the lower end. And, there may be some places higher up the list where I might rethink. And we certainly should have that discussion, right? But you can do whatever you want there. So what I'd ask is, given that there is room against that initial envelope, but did anyone propose changing anything?
Well, I guess my thought is, given the suggestion that we might reopen the opportunity for applications in the workforce realm, and if there is room within sort of our, the budget that we think that we have, that we could, at the very least, contemplate, or I guess at the most, earmark that excess for workforce should we get some proposals in that would warrant, the expenditure of those dollars into that area.
Yeah, the one, and that's certainly something. The one thing to clarify is this isn't like a fixed amount that the panel has to spend, right?
Yeah.
It's going to go up to the Spark Executive Committee. They're going to make trade-offs and all that. But would anyone else, though, be interested in modifying the envelope for workforce pipeline development, given what McLean just said?
Can you remind me or us, is there 780 million that has been unallocated? Not that the executive committee is going to choose to allocate all that, but is that the total between the whole process, not certainly just our panel?
It's a moving target. And so coming out of the last legislative session, I mean, our estimate, we're still looking, and there are some monies from previous allocations coming back. But if everything stands coming out of the last legislative session, there's probably 400 to 450 million total now. That being said, don't know whether all that stands, don't know whether some of the other funds could come back, like around UI. So the thought would be give the Spark Executive Committee, more things to think about so that they can make trade-offs at their level over time and provide flexibility just in case where this all comes out. So yeah, there isn't, it would be unfair to say it's $721 million fixed to be allocated at this point.
I think if we're going to increase any of them, I'm with McLean. It'd be with the workforce pipeline development, just because there was not just lack of specificity or system-wide approach with that particular sect of what we decided. So if going back to stakeholders and asking for additional input, I would increase that if we're gonna do that.
Would anyone want to increase that to like 15 to 20 or keep it the same? I just want to make sure that we get what the group thinks.
Increasing it
What,
15
Robin?
to 20 or 20 to 25, either one.
If we moved it to 20 to 25, would anyone disagree with that?
No, I agree with that too, John.
Okay. Okay, let's shift that to 20 to 25. Anything else? Once again, those are just ours. I believe that the, just so you know, in terms of the other panels, the connectivity one kind of is on a riding scale. But I think the top end of that is closer to 250, 275, lower end, but you could go below it, lower than that. Efficiency and modernization is more on the 100 to 150. Economic revitalization, just going to have to see, right? But the goal was to give the Spark Executive Committee enough room to play with. So, once again, though, I'd argue if people don't feel strongly about changing these, don't change them. So,
The other one that I would want to go back and take a look at is community-based resources and navigation. Over the last several decades, so much of the care of, and I'm thinking specifically about behavioral health, so much of the care of people living with mental health issues has been pushed to the communities because the state resources have continued to decrease. So I would be in favor of increasing that category relatively significantly. I mean, we had some really good high fit submissions. I think there's good work there, and we have, as a state, pushed that responsibility to communities. So I would relook at that one.
do you have a proposal? Once again, you wouldn't need to change the minimum in the target, right? You could decide just to change the target up. But any thoughts about what you would move that to, or do you want to go back to the idea submission slide?
Yeah, let's look at that idea submission slide again. And I don't know if the rest of my colleagues, how you feel about that idea.
Well, let's look at it and then we can talk about it. Or you can talk about it. Go ahead. Were you talking about health facilities and program expansion, or were you talking about community-based resources and navigation?
I think I was talking about the one before this.
Okay. Go ahead.
I think that's the one I said, but that's,
Targeted supportive housing and employment.
no, this isn't the one I was thinking of. Maybe it was that community, the first one you were at.
Okay. Could you go back to the submissions in that area?
Yeah, this is the one I was thinking about. I know there were a couple that had just huge asks, 20 million. I think there was a 30 million, but I mean, I wouldn't be supportive particularly of giving that amount of money to two very geographically defined areas, but maybe give more money to this large category. I don't know. I'm rambling. What do you guys think?
Any thoughts? Why don't you go back to the summary slide now? Let me, I guess, kind of force the discussion around community-based resource and navigation, which I believe that one was. You could say it's 15 to 35 if you wanted to, rather than 15 to 25, or anything else, Anyone have any strong feelings about that? Robin's made a mention there, but anyone else? One way or another? Okay, McLean says not opposed. By the way, Robin, I threw out 15 to 35 instead of 15 to 25. Correct me if you were thinking something different.
No, I think that's fine.
Anyone opposed to that? All right. So I guess kind of given that, are people pretty good with where this is now? Anyone have any, feelings of uncomfort based on where this is? Okay, well, let's continue then. So around next steps. So we need to work with the chairs primarily, but we will be asking for input back from the panel, optional input, to set the funding request to Spark for each prioritized program with the associated ideas. There's going to be, and we've created somewhat of a common template around that, but really all the information in it needs to be what the panel says. So we will show drafts of that to you guys based on the information that's in here. So that is the next step with regard to the process. So you'll be seeing more on that on the coming days. Go to the next slide. I think that has the timeline. Oh, it doesn't. Okay. So what's going to be in that basically is going to be the summary ask, as well as detail around the program reports themselves and the idea submission ratings. The other thing that we want to be able to provide for each one of the panels to the Spark Executive Committee is just kind of a breadcrumb trail so that they can understand kind of how the panel got to where it got to eventually, rather than having to, watch hours and hours of stream sessions. And go to the next slide. And so the target date for the presentation and discussion really between the chairs and the Spark Executive Committee is April 18th. So that would be the chairs presenting. And I think we're also going to have the panel members kind of get invited and sit in on that as well to be able to listen in on those discussions. At that point, once the Spark Executive Committee has gotten the information, the recommendations from each one of the advisory panels, they're going to need to work through, what should an integrated decision look like. And as part of that, may go back to the panels with questions or requests as well during that period of time. But this is generally the way the kind of timeline would lay out. And like I said, as we work with the chairs to kind of refine all the materials, particularly to conform to what came out of the discussion today, we'll give the panelists an opportunity to look at all the materials and provide any additional inputs. Go to the next slide. I think that's about the end, right? The optional homework, review the detailed program reports for input via survey. We'll send out the email around that. Chairs present. Spark Executive Committee reaches out with any additional questions, and panelists will be notified, once the Spark Executive Committee makes a final recommendation. With that being said, I said it up front, but really, thank you for all of your engagement in this process. We asked. This was an incredibly broad area, and I know that we asked a lot of all the panelists, and I just want to say from the bottom of my heart that I am incredibly impressed with the focus that you applied to this and the judgment. Anything from the chairs?
John, I just again want to echo how much I appreciate everyone's time and attention and effort on this, and you and your team's work in organizing and walking us through the process. And I think we've done some good work, and hopefully the presentation to the executive committee will go well and they'll heed our recommendations.
Okay.
I agree. When we started this, I had no idea how this was going to go. But it's worked and it's made sense. And I just so appreciate everyone who has participated. I just appreciate your time and your attention and your focus.
Great. Well, thank you, everyone. With that, we will get done a half an hour early. Appreciate it.
Bye, everybody. Pleasure working
Bye.
with you.
Bye.